Hello, and welcome to Better Living for Better Health. I'm Melody Nall with the Kentucky Cancer Program. I know a lot of times when we think about the health department, we think about flu shots, we think about children's immunizations, but we don't always think about services that are there for women. And today I have two guests with me that are going to tell us more about that. I have Sharon Godec, who is the Director of Nursing at Purchase District Health Department. Welcome, Sharon.
Thank you.
And I have Peggy Hayes, who is the Nurse Practitioner at Purchase District Health Department. I'm glad you're here, Peggy. Thank you. What I would like to do is just start out with a little bit about each of you. If you could just share maybe how did you come to work at the health department, how long have you been there, and some of the things that you do there, just so we can get to know you a little better.
Okay, well, I guess I can be first, being I've been there the longest. I've been with the health department over 25 years, and for the last 17 and a little more, I've been Director of Nursing for the District Health Department. I help to supervise the programs, try to oversee the hiring, do a lot of things, do publicity for the health department, as well as participate in a lot of the programs at the state level.
Okay, thank you. Peggy, what are you up to?
I've been at the health department, it'll be 20 years starting this January. I've been a nurse practitioner for 6. I just go to all the different health centers. We have 8 centers in the district and do family planning and cancer screening.
Okay. Would either one of you like to share the counties that you work in? I know you're here in McCracken, but there are other counties that Purchase District works in.
Sure, we cover Ballard County, Callaway County, Carlisle County, Fulton County, which has the 2 health centers there, Graves County, Hickman County, and of course McCracken.
Yeah, I have to go through that list in alphabetical order. Okay. What are some of the services that are available for women? I mentioned at the top of the program that we're very used to hearing about flu shots. That's a hot topic in the fall. But what is available for women and what types of programs?
You want to go ahead, Peggy?
We do cancer screening for women who, our main focus is like 40 to 64. Women who do not have insurance, or their insurance is so much that they can't really afford other services. We do see women who have Medicare and Medicaid also, but our main focus is the 40 to 64-year-olds who have nothing. Then we do family planning also.
Okay, so that would be women who are under 40, they would have the cervical cancer screenings
also, yes.
With that group. Okay.
And all of those women get a head-to-toe physical exam, and we offer mammography for the women.
Okay. Now, I have a heads up here, there is a program called Kentucky Women's Cancer Screening Program.
Right.
Of which the local health departments take part in that program and provide services. Could you tell us a little bit about that?
Well, that's where we screen for breast and cervical cancer, and we go ahead and do, like I say, the head-to-toe physical exam, make arrangements for the women to go out and have a mammogram. The clinical breast exam, of course, is a component of the head-to-toe physical. Also, a pap smear is done, and these women, if a problem is found, then we pay for the diagnostic part of it. After that, there's funds available for treatment for cancerous and precancerous.
Okay, and we'll get into more details on that in just a moment. But Peggy, if you don't mind, we may have some women watching us today who've never been for an exam. And if you could just kind of walk us through what that might entail, you know, from the time they come in the door.
Okay. Well, the first thing they need to do is call and get an appointment at their local health department. Once they get there and they arrive for their appointment, they have to go through the registration process. So they ask information like name, address, social security number, telephone number. If they do have Medicaid, Medicare, or insurance, we make a copy of that. They have to sign a consent for services. and then usually after that time, they see the nurse. The nurse takes their blood pressure, does a height and weight on them, sometimes does a hemoglobin and a blood sugar, and we can also draw blood for cholesterol. They ask a lot of questions, medical history, surgical history, last menstrual period, what medications the patient may be on, if they're allergic to any medicine. And then, after all of those questions, they do come and see the nurse practitioner. And what we have them do is come in a room. It's a private room. Usually sometimes as an assistant, there's someone that's helping just with the procedures. They get undressed. They sit on the table. They get a head-to-toe physical. We listen to their heart and their lungs, clinical breast exam. At that point in time, usually I teach people how to do their own breast exam. And the thing that they need to remember is they want to do their breast exam after their period. If they're not having periods, then they need to do the breast exam once a month. The best time would be maybe a date that they could remember, like maybe their birth date, or I think the local television channel does on the 6th of the month reminds women to do their breast exam. We give them a little pamphlet for them to take home so that they'll remember how to do their breast exam. Then we go down to their stomach, feel of their stomach, and then we do their pap smear. And it's not the most comfortable thing in the world. Nobody enjoys doing that. I often tell patients something has to be wrong with you if you enjoy getting a pap smear. So of course they always laugh, and that kind of breaks the ice too. I try to tell them everything that I'm going to do. We do a pap smear. A pap smear is a screening for cervical cancer. That's really all it is. Sometimes it will show some incidental things like maybe an infection like yeast, maybe trichomonas, but mainly it's a screening for cancer. Then there's a pelvic exam, and that's where a finger is inserted into their vagina. Their stomach is compressed so that you can feel their ovaries and their uterus to make sure those are normal size. A lady who's 50 and over really needs a rectal exam, so we usually encourage that to be done. And then they take home Hemoccult slides to check their bowel movements to see if there's any blood in their stool, and they bring that back to the health department.
Okay. And just share with us what screening that would be.
The screening is the colon cancer screening.
Exactly. Okay, thank you.
You're welcome. And during that time, we do, counsel them on perimenopause symptoms, menopause symptoms, talk to them about their calcium needs, about osteoporosis. We have handouts that we give them concerning all of that. Try to answer any questions that they may have. Then also, if they're over 40, they're scheduled for a mammogram before they leave our facility.
It's a really thorough exam. When you say head to toe, you really mean it, don't you? Yeah. As far as women coming in, I love how you said that you explain everything to them before the procedure, and I think that's so important because that helps alleviate fears, as they're coming to a situation that's not so comfortable. But I appreciate you sharing that. What are some of the risk factors for breast cancer and cervical cancer that you might look for when women are coming in?
The most important risk factor for breast cancer is just being a woman. 99% of breast cancers are in women. And the other thing that's really important is you think that breast cancer is for, you hear a lot about younger people, but actually your risk increases as you get older. Then also, if you have a family history of breast cancer, and that would be like your mother, sister, aunt, that makes you a little bit more at risk for breast cancer. I think the statistics right now are like 3 in 4 women with the family history. So, it's kind of important.
But if there's not a family history, just by being a woman, you're at risk. Because
Women
I don't want
getting
people
older.
to have that false sense of security. Well, no one
Right.
in my family has breast cancer,
Right.
so I'm okay.
There's other things that they consider controllable, and that is your weight. It seems like skinny women don't get breast cancer as much as women who are obese. If you eat a lot of things high in fat, high in calories, if you consume a lot of alcohol, if you're a smoker, if you don't get a lot of exercise, those are controllable risks that we all can do something about those.
So, and those are the similar risks we hear for
Everything.
heart disease and everything else.
Everything.
Yeah, okay.
As far as cervical cancer, the risk, of course, are cigarette smoking, starting having sex at a young age, 18 or younger, having more than 3 partners in a lifetime, having a partner who's had multiple partners, having a partner who's had partners with dysplasia, abnormal pap smears, HPV. HPV virus seems to be the main cause of cervical cancer.
Yeah, we're seeing a lot in the national news with that right now, and we could probably do another whole program just on the possibilities of a vaccination for cervical cancer. So we're seeing some new developments. Yeah. Well, we want to take a break here in just a moment. When we come back, Sharon, if you don't mind, I want you to go over the eligibility requirements for women for both the
Okay.
screening program and the treatment program. We're going to have that on the screen for you so that you can look at that during our break, and we'll be back in just a moment. Welcome back. I want to thank my guest again, Sharon Godec and Peggy Hayes with the Purchase District Health Department. And as we left, we were talking about the Kentucky Women's Cancer Screening Program, and we've heard about what happens when the woman comes in and everything that happens, but if you could tell us who is eligible for that program, Sharon.
Okay, women that are enrolled in the program are primarily those ages 40 to 64 who are uninsured, those that have no other means of getting a mammogram or a pap smear done. Also, those women are eligible on a sliding fee scale because the sliding fee scale is based on family income, and so a mammogram may cost the woman something, but it won't be nearly as much as if she had to pay for it herself at the doctor's office.
Right.
And then if a problem is found, we do the same thing. We refer the women out for diagnosis, and if the problem is found to be cancerous or precancerous, then we can get them a special medical card, which we sign them up at the health department for that. In order to be eligible for that special program, those women have to be screened through the health department, and I think that's something
Right.
we'd like to really stress, because we can help those women who do participate in the program.
Right. Those treatment dollars haven't always been available, have they?
No, just for the last 2 or 3 years,
Yeah.
I believe, and that's been a real godsend for a lot of people, because before that, we'd diagnose them and then we couldn't pay for the treatment.
Exactly.
And so it's much better.
So we really want to make sure that women understand that the program is there. We're even doing some special emphasis with the physicians in our community, that they understand that the program is available as well. You know, a lot of times we talk about women who are uninsured, but we have people that just have a change in their insurance status. I know in our area we've had some companies that have, you know, left us, and there are employees that lose their health insurance. So even if women have had health insurance previously, they may not, and we want, you know, them to know that this program is for them as well. And
Right.
and I think the statement that you said, that they have to be screened through the health department to receive the treatment dollars, is just a very important one for us to get out.
It is, because we don't want someone to miss out on that assistance because they didn't know that it had to be screening through the health department. And we have some really good nurse practitioners and,
Oh, yeah.
and a physician who works with us regularly. So
Oh, absolutely.
we're
The quality of
most
care at the
fortunate.
health department is excellent. And for anyone who think they might be getting less than, I just invite them to come down and meet the nurse practitioners and the nurses that are there, because it's just excellent care. So, well, we were talking about getting the word out, and there's another component of Kentucky Women's Cancer Screening Program, and that's their outreach program. And I have the pleasure of working with you on this particular project, and that are the local coalitions that are funded. And if either one of you would like to talk about coalitions, and what are they, and how do they work?
Well, coalitions are groups of people who are interested in breast and cervical cancer awareness. Many of the people that participate in the coalitions are survivors. Many of them are community members who are very interested in promoting women's health issues. And it's just a different group of people that join together. A lot of the mammography people come, people from the hospitals. They all join together and try to promote mammograms, pap smears, those kinds of things. And when you might have seen the billboards out there,
Right.
the tray liners in some instances, stressing that people can call their local health department.
Yeah, trying to use some innovative ways to get the word out. I know in October, if anyone's driving around Paducah, especially, they might see pink ribbons in downtown Paducah or on the hospital campuses, and just a variety of places. And those were actually put up by McCracken County coalition members, right?
Right. We have coalitions not just in McCracken County, but also in Ballard and Carlisle. They have a joint coalition. And in Graves County, they have a coalition, and I understand that Marshall County does too.
Yeah, they do. And you're right with the survivors. They're very passionate and dedicated about getting the word out. And I know both of you are involved with coalitions all over the district. Can you think of any other activities that coalitions have put on that come to your mind that may have been effective at increasing screening or just getting that awareness out?
I think in Ballard County they did a tea for beauticians. Wasn't it the beauticians that had
Yeah,
like
a couple years ago. And they've done some things at the Barlow House out there and at the Extension Office in Bardwell, trying to attract people's attention to the breast and cervical cancer screening. And then we are able to purchase a few incentives for women who come in to get the screening, and sometimes we have some very nice things to give away.
Yeah. If someone wanted to be involved in the coalitions, if this has kind of piqued their interest, and maybe they're a cancer survivor, maybe we have a healthcare professional in the area that's watching us today, and if they wanted to be a part of the coalition, are there requirements for membership, or how would they go about being a part of that coalition?
Everyone is eligible. They can call the nursing supervisor at any one of the health centers in our area and let them know that they're interested in participating. Of course, they can call the Kentucky Cancer Program, and they'll be
Absolutely.
more than happy to steer people to the right coalition for them. And they can always call our district office in Mayfield.
Absolutely. Other things that you would just like to share, Peggy, with women? I know you see a lot of women that come into the health department. Is there anything that comes to mind that you would want to share as far as positive health information or just suggestions that we can do to stay healthier?
I think, it's hard for us to be women. We always want to put everyone else ahead of ourselves, whether it be family, work, everything else, everything comes before we do. And I think we just need to take time a lot of times just to do something for ourselves and to make ourselves healthier. Exercising, just taking a walk. I read an article today that in fact talked about cancer survivors who actually exercised 5 days a week for 3 hours actually had a longer survival rate than someone who doesn't exercise. So, I think just, the regular things, exercise, eating right, not smoking, just taking care of ourselves, and just doing little things for ourselves to kind of relieve stress. If it's nothing but reading a book or going for a walk or just doing something for yourself.
Okay. You were also mentioned earlier with cervical cancer that has been with younger women.
Right.
And will the treatment or the screening program apply to women who are under 40 with cervical cancer or not? I'm not certain on that.
I believe that we can help, but they probably will not qualify for all of the funds.
Okay, so that would just have to be something that
That's
if they,
individualized.
Okay, and there are people at the health department that will help them and walk them through the process with that. Okay. Sharon, any thoughts that you have as far as information that is going on at the health department, especially related to women and things that you'd like to share with us?
I think some of the things that we've been doing is going out and putting displays like at the libraries and things like that during the month of October to bring awareness to the breast cancer screenings. During January we try to stress the cervical things, but as talking with some of our health educators who've been out doing some of these health fair type things, they're telling me that some of the women have never had a mammogram, and recently I heard about a woman who did have a lump in her breast and she just didn't want to go. She said she'd rather not know. And I'd just like to encourage those women. It's not hopeless. If you have a lump in your breast, it may not even be malignant, it may not be cancerous, but it's better to get it checked out early.
Yeah. I think the figure is like 80% of the lumps that women find are not cancer. So the odds are really that it's not.
Right.
And you can have that peace of mind.
And it's really important that women learn how to do their breast exam, once a month, like we talked about earlier, mainly just so they get familiar with their own bumpy stuff. There's a lot of bumps in there that it's nothing. And if they get familiar with their own breast tissue, then they're going to find something much sooner than if they waited a year to come, and get their clinical breast exam. All three things are very important: doing your breast exam yourself, getting a clinical breast exam, and then getting your mammogram too. And if you do all three of those, you're doing really the best that you can do.
Yeah. Peggy, I heard recently a local physician talk about this, the three-tier approach to women's breast health, and he compared it to a three-legged stool, and that if you were to take away any one of those legs of the stool, of course the stool would fall. And I think that's a really appropriate analogy that we can think about, that all of them are important. The clinical breast exam, as you mentioned, is just once a year. And a lot can happen with a woman in that year, so she does need to know and be familiar with her breast tissue so that she can report changes. Yeah. Anything else? We want some final thoughts, I think, for women. As far as breast and cervical screening, if you'd like to go over the guidelines for cervical and breast before we leave.
The screening, okay. For breast, all women over 40 need a mammogram every year. For cervical cancer, the guidelines kind of change every once in a while. Right now, I think the American Cancer Society says that you should begin having Pap smears at age 21 or 3 years after you start having sex. And then if you've had a hysterectomy and it wasn't for cancer, you really don't need to have a pap smear every year, but you do need to have your pelvic exam every year.
Right. So it's important to have that conversation with your health professional. Okay. Yeah, I know there's like 4 or 5 sentences now for the cervical cancer screening, and we do have some materials at our office, and I know you do as well at the health department if women have questions, and they can talk to their personal physician. Sharon, any final thoughts that you want to share about the program?
Well, I'd just like to encourage women not to go without the screening. It's so important in their lives, and it can mean so much not just to them but to their families.
Absolutely.
After all, women are the heart of the family, and we need to keep them well.
That's right.
And so
we've got a slogan that if cancer takes them, our moms and our grandmoms, who will take care of the family?
Right.
And I think that's very appropriate. Well, thank you so much. I know we could talk on, and I appreciate you being here, both of you. Peggy, thank you for being here. Sharon, thank you for being here.
Thank you for asking us.
It's a wonderful opportunity, and for women that are interested in cancer screening, and we really want you to know there's really no age for a woman that they cannot access screening. From 40 to 64, if you're uninsured, call your local health department. There is a program there where you can have a reduced cost or even a free mammogram and the other cancer screenings. If you're 65 and older, we have Medicare. So really, we have an opportunity for all women to have those screenings. At the Kentucky Cancer Program, we work hard to get educational programs out and try to share that information with women so they know what's available in the community. We have a program that I want to tell you about. It's called Just Us Girls, and it's in a fun format. It is we call it a tea party, but it can be held at any time of the day, and we talk specifically about breast and cervical health. If you're interested in hosting something like that, please give me a call at the Kentucky Cancer Program. If you have questions about the health department programs, please call the McCracken Health Center at 444-9631 or the District Health Department at 247-1490. It's been a pleasure being with you again today, and I'll see you next time on Better Living for Better Health.